So now let's talk about listening and spoken language. The listening and spoken language approach to language development teaches infants and young children with hearing loss to listen and talk with the support of hearing technology such as hearing aids, assistive listening devices such as FM systems, or cochlear implants. You may also hear it referred to as auditory oral education, auditory verbal therapy, AVT, or education, AV-Ed, and oral deaf education. They are all committed to teaching children who are deaf and hard of hearing to listen and talk. Listening and spoken language is a developmental approach which follows typical child milestones by introducing skills at the ages and stages during that optimal period of language learning of birth to 3.5. Auditory verbal therapy is a specialized type of therapy designed to teach a child to use the hearing provided by a hearing aid or cochlear implant for understanding speech and learning to talk. The earliest possible identification of hearing loss with immediate fitting with amplification, as well as prompt intervention, is tantamount to success. That amplification may be hearing aids, cochlear implants, or BAHAs. We share with families milestone trackers, so they'll be able to follow along during sessions and keep up and be an advocate for their child. We want them to track this progress, so they'll be able to follow the progress as the language develops. This approach also encourages interaction and inclusion for children from the beginning with hearing peers. A little basic information on auditory skill development. Auditory skill development is defined in 4 stages by Norman Erber. The 4 stages describe the normal sequence of development of listening skills in children with typical hearing and children with hearing losses. The first stage is detection, and detection is that awareness of the presence of sound or absence of sound. The next stage is discrimination, and that is when the child is able to determine if the sounds are the same or different. Next is identification. That involves the child being able to label or name the sound that is heard. And the last is comprehension, which is the highest of the 4 levels, and it bridges that auditory perception with cognitive and or language abilities. With this modality, a child's age is broken down into chronological age and hearing age. Their hearing age is the time from activation of their cochlear implant or when they were first fitted with a hearing aid. So if a child was implanted at 9 months of age and their chronological age is now 12 months of age, we would consider that child to have a hearing age of 3 months old. With therapy, we hope for 2 months of listening skills progress per 1 month until the child is able to catch up to a level that is commensurate with that of their same age peers. As with ASL, this modality relies on the early intervention provider's unique skill set of early language development, helping with expression of wants and needs, reading, play, and cognitive skills and social skills. Those things you all do every day. Only this time, instead of a visual language approach, this one is going to be utilizing the child's residual hearing and relying on audition or the child's hearing to acquire language. So let's look at how to assess language skills with a child who's following listening and spoken language. Let's start with a few of the tools that are available to help guide listening and expressive language skill development. The first item pictured here is the Functional Listening Index by the Shepherd Center. It gives the professional and parents skills divided in 6 phases. The first one is sound awareness, then associating sound with meaning, comprehending simple spoken language, comprehending language in different listening conditions, listening through discourse and narratives, and then advanced open set listening. This is in a checklist form, and it will also help guide parents and professionals' goals and outcomes for the child to learn to listen and talk. I make sure my families have a copy of this tool and keep it in their therapy notebooks and check off as we go along. The phases go beyond early intervention, and I always want my families to be able to advocate for what their child needs even after they age off my caseload. Another great tool is the Cottage Acquisition Scales for Listening, Language, and Speech, or called CASTLES. This is put out by the Sunshine Cottage School for the Deaf in San Antonio, Texas. This tool keeps track of milestones with respect to auditory skill development, along with speech and language skill development. It focuses on listening, speech, language, and cognition. These areas are followed in 5 separate criterion reference scales based on the research of typical hearing child's language acquisition. There's the pre-verbal level, a pre-sentence level, a simple sentence level, complex sentence, and then there is also an additional level of sound and speech for record keeping. I've pictured here the pre-verbal level, which you can see has a few of the skills listed on the example. You can see where there's a spot to check off if the skill is E emerging, M mastered, and then if it's generalized across various settings. Another tool for tracking progress is the Auditory Learning Guide, and it was developed by Beth Walker. It is a guide to help professionals with new listeners. It addresses auditory skills in order, as expected in the first 4 years post-amplification or cochlear implant amplification, and it is color-coded. It moves from the sound awareness, which is the speech and environmental sounds, to a phoneme level, which is that speech babble, to the discourse level, which is auditory processing of connected speech, sentence level, to identify familiar stereotypic phrases or sentences, and then to the word level. The blue area across the chart highlights all the skills we hope the child masters by the end of year 1 of amplification. This is another chart I have families keep with their records. As with the ASL tools, these are just a few suggestions of tools to assess progress for children that are using listening and spoken language. Now that we have discussed some skill trackers for professionals and parents that will help with goals and outcome writings, accountability, and therapy planning guides, let's talk about what early interventionists can begin to put in place for their visits. So the first thing we want to do with families is make sure that they set up the listening environment. We want to start the child on learning to listen in an environment that helps a high likelihood for success. We make it as easy as possible to hear sounds and speech, and then work toward more typical everyday settings as we go along. A few ways we want to help parents in one of those first visits is to give them suggestions to provide an optimal listening environment. Now, as most early interventionists will attest, this is usually not possible all day, on occasion, and in some homes ever if at all. So sometimes I will tell my families it is a goal to shoot for in their day to help their child. This is not forever, it's just this beginning part of the child's listening journey. So very important, we start off with turning off the TV more to minimize that background noise. When needed, move closer to the speaker. Sometimes we need to use environmental modifications, such as rugs and draperies, to reduce reverberation in a room. Depending on the child, if he has a better ear, the parents should sit, when talking with the child, on the better hearing side. Always check the equipment. It should be a daily affair. Integration of family routines and auditory skills. Assimilate those listening skills into routines all day long. And then provide meaningful interactions, talking about your experiences as they are occurring. Narrate routine in your day. One of the first things we're going to start with in therapy each visit is the Ling 6 sound test. Daniel Ling was a pioneer of auditory verbal practice. Among his many contributions to the field, he is most known for the Ling speech assessment and teaching model and the Ling 6 sound test. The concept behind Daniel Ling's 6 sound test was to select familiar speech sounds that would broadly represent the speech spectrum from 250 to 8,000 Hertz. This spectral range is the same range tested by conventional audiometry. Ling used isolated phonemes to target low, middle, and high frequency sounds. Doing this test will help test a child's hearing and check that the child has access to the full range of sounds necessary to develop speech. So these are the Ling 6 sounds pictured here. The audiogram shows where the sounds fall in decibels or loudness or frequency, the pitch. If you notice that some sounds seem to show up twice on the audiogram. A sound such as ah is made up of various formants or bands of speech energy. While a speech sound is perceived as one simple sound to our ears, some are composed of multiple formants. If a person does not have good access to be able to hear all of the different bands of energy, it is easy to mishear and perceive sounds incorrectly. For this reason, regular mappings of cochlear implants, or that programming a cochlear implant to the specifications and needs of its user, and regular programming visits for hearing aids are very important. The Ling 6 sound test covers a range from high to low frequencies. Is a low frequency sound. Is at the center of the speech range. E has some low frequency information and some high frequency information. U has low frequency. SH, or sh, is in the moderately high frequency speech range. And the S sound, S, is at the very high frequency speech range.
Did you hear that? Good job. Let's put the block in. Bye-bye block. Good job. Let's try the on the other side too. It's okay, good boy.
I heard you.
Good boy. And okay, move Mr. Tad, and I'm gonna take him out of the camera probably. So you can go more to the right side. Let's see. And do E. Good boy. Did you hear Mama?
Stay on this side.
Yeah. Try an E again. I'm gonna see if he looks that way. E. There she is. Good boy. Nice job.
Hi. Up front.
Ooh.
Good job, Thomas. Good job.
This is one of the first activities I do with a child as soon as they receive amplification. I model with the family how to present the sound test and work on ways they can do it daily in their routine. In the beginning of this activity, I am looking for any motor response from the child. It could be turning to look for the sound source, or the child just may become very still, or they may stop sucking on a pacifier, to name a few ways you might notice that they heard the sound. I usually start with a family member presenting the sound from behind the child or sitting next to them. We make the sound at a normal conversational tone, starting at about 8 to 12 inches from the mic on either the hearing aid or the processor of the cochlear implant, and then increasing your distance away, but not increasing the volume of your voice. This needs to be done in a quiet setting if possible. And I give wait time for the child to react to the new signal. For young children, we will reward them with a toy or rattle when they respond. As the child gets older, we might use a bucket and drop a block into it, or use a puzzle or a toy or a shape sorter.
All right, put it in. Turn it. Yeah. Good. All right.
Mommy.
Let's listen one more time. Yeah. Put it in. Yeah. All right. Let's listen. No. Sound go.
So next in therapy, after we checked how the listening equipment is working, we will start with the learning to listen sounds. The learning to listen sounds are a common strategy for teaching spoken language through listening to early learners. The learning to listen sounds were chosen by early auditory verbal practitioners because they are easy to hear for most babies wearing hearing devices, and they follow typical language development, which makes playing with them fun for babies. Pictured here are a sample of the sounds. I used this one-page quick list for families at one of the early visits. Included with this module will be links to the document for the full set of sounds I use with families, as well as this quick one-page list. These sounds are important for several reasons. The sounds are developmentally appropriate. These are sounds we would use with any child in their early language development. They are a sound object association. A child may not have the capability to say a word such as cow, but they may be better able to say the sound moo to identify that picture of a cow. And then also, natural articulation play is another piece of that's very important with these sounds. Instead of practicing speech sounds in isolation, playing with the learning to listen sounds can cover all the sounds of speech in a way that is play-based and natural. The learning to listen sounds contain all the suprasegmental features, early vowels, and developing consonants. Suprasegmentals here are duration, which is short versus long, intensity, loud versus soft, and pitch, high versus low. And this is where babies start imitating. Think, uh-oh, an expression a little one will use that contains pitch change, high to low, uh-oh, and two sounds with short duration. Given one of the lists for the learning to listen sounds, I have families put together their own bag or box of toys to use. I have them use their kits daily, maybe 1 or 2 sounds before a meal, a few during playtime or before bed, whatever fits in their family routine. I also have them put the kits up after each time they finish, so when they pull them out, the toys are fresh, and the little ones are always excited to see the toys that are not with the other toys in their toy bins. So I instruct parents when using the toys to name the toy, make the sound, before they ever pull it out of the bag. This gets the child's listening attention first, as they will listen about 50% less once they see the toy. The parent makes the sound, pulls the toy out, and all of the adults present, and sometimes a sibling, take turns making the sound. This gives the child plenty of opportunity to hear this sound repetitively. Then the toy is given to the child, and we give them time to hopefully attempt to make the sound as well. It is this beginning wait time or lag time that is very important, as the child is learning to process these sounds and then produce that vocal imitation based on what they heard. The wait time for imitation may be longer in the beginning, but as children refine that auditory feedback loop, that wait time becomes a bit shorter. After the child is finished with the toy, we put it in a container or a box and we wave bye-bye to it and say bye-bye. This provides another repetitive opportunity for language and imitation. Once a child is able to make the sounds consistently, we target the name of the item and move on to more difficult sounds.
Ah, ah.
So where does the early intervention provider that's going into the home with a child that's following listening and spoken language, where do they begin with their sessions? Remember that equipment check. We're going to do the Link 6 sound check first. In the beginning, we are looking for any motor response that the child has heard you. As the child becomes more consistent, I will have them perform a conditioned response, such as putting a block in containers and working towards repeating back the sound that they are hearing. So if I say ah, the older child will usually repeat ah, and I know that they heard it accurately. Remember that these sound checks are also going to help the child have better programming visits with their audiologist. Next, we will always include some play with the learning to listen sound toys. We may pull toys out of the bag as described earlier, or we may put the toys in boxes or hide them under cloths. Usually my families are a great resource for coming up with new ways to play with the learning to listen sound toys. In early intervention, goals and outcomes are family identified and centered around family activities. I try to plan my session then around a family activity that can use the language goals of the child through listening. We may go for a walk outside on a nice day, play with a favorite toy, help clean the table after breakfast, or pretend play. For babies, it may revolve around the early motor activities of sitting up and reaching for a toy, rolling a ball, crawling to mommy, or standing at the sofa to play. Most often, meal times are very motivating, and a child is happy to say more or label a food. We use plastic knives and cut banana with mom's help, or we make a choice between puffs or goldfish. I always use a book and have a song as part of my visit. Again, as with my children using ASL, I save time at the end to have the parent write down with me what we worked on so we can carry over the rest of the week. Again, the number one material I use is a book. As our children learning ASL need 5 to 10 books a day, the same is to be said for our children following listening and spoken language. We want books with pictures that may occur on each page to give us multiple opportunities to model. And then as the book continues, to give the child more opportunities to fill in the blank. If you name the bird on each page, later in the book you might point to the bird now and say, I see the, and leave a spot. Slightly lift the page and prompt with, turn the page, to learn that familiar phrase. Help the child begin to tap pictures as they're named. Mix up the volume, the tone, and the pace to enhance the interest of the story. Again, let the child pick out the book. And as we mentioned earlier, give leading questions and not always put the child in that hot seat. Remember, to teach, not test with young children.
They're cooking the apples. Look, she's peeling the apple. You see her peel it? She's taking the skin off. And, oh, he's eating a piece of apple. Look at all the food cooking on the stove. They made a pie. Do you like pie?
Yeah.
Does Daddy like pie? Oh, Daddy likes pie.
So let's talk a little bit about the importance of singing. Singing provides enhanced auditory information without distortion of sounds. The sounds are heard easier, and we didn't have to make our voices louder. Singing is a right-brained activity. Speech typically occurs on the left side of the brain, so singing on the right side is one more way to use a little more brain power. There's repetitive phrasing, E-I-E-I-O, or row, row, row your boat. We're making these repetitive phrasing without being boring. Children need to hear new words many times to learn them. But if it's boring, they're not going to want to repeat them. With songs, the lyrics repeat naturally in a meaningful way. Think about also when you sing the wheels of the bus. How many times do you hear bus, wheels, and round in that context? It's a great way to learn. Music helps you slow down. When you sing, your rate of words per minute goes down, which helps children catch on to new words and concepts. It's easy to speed up when you're speaking, but keeping the rhythm of a song helps you remember to slow down. Those super segmentals of duration, intensity, and pitch are there being used in action. And then that rhythm, the prosody or the tune of language, sequencing, and then the oral motor play is another benefit of singing with children with hearing loss.
Now what do you get to do, Thomas?
So let's talk about a few strategies to use when you're working with a child who's following listening and spoken language. And these are great to use and to coach parents to use. Many of them work with our children following ASL as well. The first one, babbling and cooing play. This is the learning to listen sound play, or peekaboo, or any of the fun face-to-face games a family may do with their baby. That hand babbling. Waiting. As we discussed, this is the time we wait before we jump into save, that silence time. I suggest to families to try to sing the alphabet in their head, and that is an okay amount of time to wait in the beginning. So we're going to prompt the child and give them time to respond. Responding to a child communication is picking up those communicative attempts from the beginning and be ready to respond. Another strategy is modeling. This is when you use another adult or sibling in the home to answer a question or make the response you want the child to make. If you want to ask the child if he or she wants juice and you need a yes answer or a no answer, ask dad or a sibling and model, do you want juice? And let them answer, and then do it to the child. This way they have seen how the question and the answer worked. Another great strategy is motherese. That's that sing-song voice that parents and grandparents use when talking to young children. Again, motherese, or sometimes called parentese, has those same benefits as singing, as it gives more acoustic information to your verbal message without distortion of the sounds. Another one is the auditory sandwich. Since we're working with children to follow listening and spoken language and learn language in the same way their hearing peers learn language, we don't want to rely just on visual and lip reading. We want them to learn to listen and hear the sound. Sometimes the sound is difficult for the child to produce, so we may show them the B sound on our lips as we're saying ball. We will do that first with auditory only. If they're not getting it, we will show them the ball on our lips, and then we go back to working on the listening first. So narrate, we've talked about this several times. Very important tool for children using ASL or for children using listening and spoken language. We want you to narrate what the child is doing. We want you to narrate what you are doing or what's happening in your home. Another strategy is using the expectant look. This is using raised eyebrows, direct eye contact with the child, or leaning in toward the child, and we sometimes call it a pregnant pause. You're making a statement and leaving something hanging in the air where you know a sound or a word is meant to be put in that place. The last one we want to talk about is using a whisper. For a child following listening and spoken language that's getting words and language all day in their home, to all of a sudden switch to a soft whisper sometimes heightens their listening. So let's talk about how to grow that child's brain acoustically. I share this list with my families from Carol Flexor on how to grow a child's auditory brain. Dr. Flexor is a certified auditory verbal therapist, a licensed audiologist, and she has done extensive research and been an advocate for children with hearing loss internationally. Many of these I have listed here from Dr. Flexor we have discussed. But the one thing she always says is, remember to remind the parents to above all love, play, and have fun with their child. This is something I try to remind parents to do often. We talked about using the hearing aid or cochlear implant and making sure they wear it every waking hour. She reminds us the auditory brain centers need consistent access to clear, complete sound in order to develop. Check the technology. Equipment malfunctions often. Again, minimize the background noise. Sing with your child. Speak in full sentences. Pronounce words clearly with lots of that melody. Stay close. Call attention to sounds in the room and point to your ear, saying that you heard that. And emphasize sounds before vision. Continuing with how to grow the brain auditorily, read aloud every day. We talked about 5 to 10 books a day. I always tell families they don't have to be 10 different books, and they don't have to be whole books, even if you just go over the cover of the book, or it can be a cereal box or a magazine. Name objects in the environment as you encounter them. Narrate. Talk about and start to describe how things sound, look, and feel. Compare how objects are similar and different in size, shape, smell, color, or texture. Very important is to talk about where things are located. We always start with in your room or on the table. Prepositions are a bridge between concrete and abstract thinking. And then describe those sequences in the very beginning. First we're going to have snack and then it's time for your nap. Talk about the steps involved in activities as you are doing them. And sequencing is necessary for organization. So as I promised, let's talk a little bit about those programming sheets that you should be filling out with families so that they know what to carry over until your next session. One of the ones I use here, making a plan to increase vocabulary and language, whether it's signing or listening and spoken language. We want to make up time We want to work to get children to age-appropriate language skills and close the gap. This is a very important piece in getting parents to carry over the skills that you have worked on in your visits. I may use a carbon-sensitized form from our infant office and fill out with families what to carry over until the next session. And then we brainstorm ideas of what they can work on in their day to carry over those skills. Families and I will fill this out, and they will put this in a place in their home that all family members can access. This is then a reminder of the book and the vocabulary to focus on this week, daily routine opportunities, and language play, and then the song. By having parents a part of the planning process, it keeps them in that position of being that driving force behind their child's success in their chosen modality of communication. By following the 136 model for newly identified babies, utilizing available resources, providing support for families as they make communication choices for their child, and then following developmental milestones with consideration given to the specifics of each modality, an early interventionist can serve children and their families that are deaf and hard of hearing to get them started on their journey.